Welcome, welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, yes, you can definitely WhatsApp on 922681060. My dear friends, this is the series that we are making. In each video, I am giving you some example of the patient, and that is coming to the general medical practitioner and his complaints or her complaints, and how the examining general practitioner doctor should think about the different causes or differential diagnosis for that particular problem. So, my dear friend, today we will discuss a case of mother has brought very small, gentle, sweet baby of 6 months, 6 month old male child, very small baby of 6 months, and she is crying continuously, or rather, he is crying continuously because this is a male child. Continuously crying is there, and naturally, you can understand that the parents, father, mother, grandfather, grandmother, they are very, very anxious when the child is not stopping of crying, because there are some preliminary measures that they take. Some unrecognized person or some new guest has come to the house or is little bit afraid of anything. Everything has been tried. 6 month old child, but the child is not stopping of crying, and the mother is telling, since last 4 hours, doctor, we are trying to make him quiet and calm and happy, but he is not stopping. Doctor, please do something. Actually, this much small child is a duty of a pediatrician to tackle with, because especially in the city areas, there are the very excellent expert children doctors which are called as a pediatrician. This small child actually should have been taken to the pediatrician. But before that, just one step before, they want to get the opinion of general medical family physician, and so the child is brought. Okay, 4 hours the child is crying. So naturally, the doctor has to think very common causes, very common causes. And what are the common causes for continuous infant excessive crying? What are the causes? Number one, doctor must ask about the feeding, whether the child is having the breastfeeding properly. That means as per his requisite, as per the necessity. Of course, 6 month old child, the mother is also knowing how to give the breastfeeding, and I am sure that means the answer will be okay. No, doctor, he is hungry or he is not taking, whatever it may be. But first question, whether the child is hungry. This is one. Number two, ask about the stools, whether the child infant is having constipation, because constipation is one of the cause for non-stop excessive crying of the infant. So constipation. Number three, is it taking especially his hand to any particular part of the body? Very interesting question, because this 6 month child cannot speak, cannot tell what he is having the problem. So the simple indirect indication that he will take his hand, for example, repeatedly is pulling his ear and crying excessively, crying excessively. So his hand is indicating where can be the problem. If the child is having the hand on the abdomen and crying, and abdomen and crying, so hand is an indicator. Hand is an indicator that he has some gas in the stomach. If he is taking the hand on biting on the another hand, so hand, where he is taking the hand, so you must observe, ask the parents to observe where that small baby is taking the hand to show you that here is the problem. So he will not be able to speak, he will not speak, but in spite of speaking, the child will give the indication to the doctor and to the parents that, see, this particular my part is having some problem. So naturally his hand, the parents, the doctor should observe the movement of the hands, movement of the legs, etc. Okay, the doctor will start examining. he will see first the anterior fontanelle. Palpate the anterior fontanelle. Palpate. The doctor should palpate the baby's anterior fontanelle, 6-month-old baby. And if the doctor is saying that the fontanelle are bulging, bulging fontanelle indicates meningitis, inflammation of the meninges, that is coverings on the brain. So there is a inflammation that is called as a meningitis. So when the doctor is having bulging fontanelle, this is one indication. Immediately doctor should check the neck stiffness. Neck stiffness. He can try to put his chin on the chest. If he is crying more, that is feeling is also stiff. Neck stiffness is another indication of meningitis, but at the same time, neck stiffness can indicate tetanus. First is a meningitis, but second thing, neck stiffness can take place because of the tetanus. Don't forget it. Next, doctor should take the torch and inspect both the ears. Inspect both the ears, especially the eardrum, tympanic membrane. If eardrum is bulging, if eardrum of the 6-month-old baby is bulging or inflamed, then it is better to put the nasal drops of xylomethazoline in the nose. Antibiotic like penicillin injection can be given to the child to relieve immediate that particular infection. Nasal drops of xylomethazoline, pediatric drops of course, and antibiotic injections, and immediately refer the patient to the pediatrician. So this is the next step. Then what doctor can do is a palpation of the limbs. Touch the limbs, hands and the legs, chest and the back, and observe all these hands and legs and the chest and the back and the abdomen for signs of injury. If there is any trauma, swelling, is there any swelling? Hands, legs, chest, abdomen and back, signs of injury, swelling or any deformity. The most essential is see whether there is an insect bite, because insect bite can also be one of the commonest cause of excessive crying. If something is pinching to his body, like safety pin, that also has to be looked for. So basically all the clothes should be removed and then the gentle examination should be done for the 6-month-old child for excessive crying. Then also don't forget to look for genitalia. 6-month-old child, look for the genitalia for phimosis or for any infection. Because of the phimosis, he cannot pass the urine normally, and that is also cause of the excessive crying. So my dear friends, my dear doctors, try to understand if infant, the child before the 1 year of old is crying and he cannot speak it out, what is his problem? Then check the hunger, check for the constipation, check for the infection, check, observe for injury, observe for the pain anywhere, eardrums, bulging fontanelles, neck stiffness, etc., etc. If child is going to be hungry, first try to feed the child. That means feeding is the first thing that one can do to stop the crying. Number 2, give the soap stick to empty the rectum if the child is constipated. Glycerin suppository. Okay. Then give the carmicide and spasmindone drops orally. Spasmindone drops orally to relieve the gas, to relieve the spasm of the intestines. If any pathology is suspected in any particular part, best way to refer the child to the pediatrician. So my dear friend, this is the interesting case which is very common, that their parents are very anxious and they bring the child for excessive crying, and what doctor should try to find it out. Okay, my dear friend, this is all about this short video, and we will continue this such type of the discussions further also. Please like, share this video and give your comments. How do you feel about all these videos? Clinical, provocating, thought-provocating type of the videos. I wish you all the best, but don't forget to subscribe my channel because you want to give push-up, boosting energy to Dr. Deshpande. I wish you all the best. Take care and see you in the next video. All the best.